Welcome to the Real News Network, coming to you today from Washington, D.C. Last night, Reid briefed members of the Democratic caucus about where health care reform is at, and to help us try to understand just what's going on in Washington in health care, because it's getting awfully confusing, is Roger Hickey. He's the co-director of Campaign for America's Future. Thanks for joining us, Roger.
Good to be here, Paul.
So where are we at? There's so many different proposals that are being talked about. It's really hard to keep track of. So as things stand as of today, as well you know, what's being proposed?
Well, it's important to remember the House of Representatives has already passed a very good bill, a pretty good bill. The action has moved to the Senate.
Okay, now in your definition by pretty good bill, you mean a bill that has a robust public option.
And provides affordable health insurance to a lot of people.
And with some serious regulation about how the insurance companies take new clients.
Yeah, as I say, a pretty good bill.
Okay.
But the action has been in the Senate for about a month now, and the action has been driven by liberals who want a good, robust bill, but thwarted by about 4 Democratic senators who are holding back their support in demanding erosion of that legislation.
So quickly name the 4.
Well, the senators from Louisiana, from Arkansas, and from Nebraska and Connecticut.
Meaning Lieberman.
Yeah. Since the Democrats need 60 votes in order to move the legislation forward, these 4 conservative Democratic senators who are acting like Republicans have enormous power to stop the whole process.
So the Senate and the House have been negotiating what the final bill will look like, and there's some kind of deal. Reid seems to be proposing something now that he thinks can get 60 votes. Do you get what is it he's proposing? Because there's been all kinds of leaks about it.
Reid is trying to satisfy both the liberals and most especially the conservative Democrats. So he's coming forward, giving the conservatives what they want. No public option, public plan that is run by the government to compete with the private insurance companies. That's basically what he's giving to the conservatives. Now, in past periods of American history, recent past, you would expect the liberals to have folded their tents long ago and realized, well, we've got to just kowtow to what the most conservative members want. Instead, because of a strong mobilization by the grassroots Democrats and activists and the left, the Democratic liberals have stayed very, very strong. Some of them, Bernie Sanders and others, even threatening to withhold their support for a final bill if they didn't get a decent
And the Progressive Caucus
bill.
in the House had a press conference about 2 months ago where they said, we're not going to vote for something that doesn't have a strong public option.
They certainly insisted on a public option. They didn't get a really strong public option, but they got a public option in their legislation.
But they're going to get a bill back to them now that may have next to nothing.
What I was trying to say is that because the liberals have stayed strong in this debate and have really negotiated fiercely, Reid had to come up with something that would satisfy the grassroots and liberals as a move forward. And what he has proposed is expanding Medicare to cover a larger percentage of the American public, letting people at age 55 and up buy into Medicare. This has been a progressive idea for some time. It's a one step toward Medicare for all. And
The theory being, if it's 55 today, it could be 50 tomorrow and 45 and so on.
It really establishes a precedent for using Medicare as the public option, something that many liberals didn't think was possible, and that's why they focused on the public option as a brand new Medicare-like independent organization. So the interesting thing about this deal is that the liberals and the grassroots are getting something offered to them in return for realizing reality that these 4 Democratic conservatives are not going to vote for a bill that has a public option in it.
Now, there's been, over the past few months, one of the critiques of the White House is that Obama himself has not really fought for the public option, and that if he really fought, there are ways the White House can put the hammer down on 4 senators if they want to get something passed any time in the next 4 years and maybe 8 years. And he never put the hammer down on them in that way. Is there some legitimacy to that
There
critique?
absolutely is. This was not Lyndon Johnson style negotiation from the White House. It was a fairly hands-off style that allowed, I think the big mistake was allowing Senator Baucus of the Finance Committee to spend endless amounts of time negotiating for Republican support and crafting a bill in the Finance Committee.
And this was an Obama strategy.
It was an Obama strategy, and it turns out that to get them anything in terms of real Republican support, certainly.
Except months of a platform for them to fight healthcare reform.
Exactly. So it lost a lot of momentum.
So there's another big piece of this. If I go on my critique of Obama here. Obama made a deal with pharma a few months ago, which essentially guaranteed pharma that we're not going to bring Canadian drugs into the United States. We're not going to, cheap Canadian drugs, I should say. We're going to protect you from generic infringement on your copyright. Many people have called it essentially a profit guarantee over the next 10 years for pharma, on the condition you stay out of this healthcare debate. Don't throw your weight with the health insurance companies, and let us duke it out with the health insurance companies so we can get a public option. And more or less, to the health insurance company's chagrin, pharma said, okay. So now we got this deal in theory with the White House. I know some people in Congress are trying to overturn that deal, but if it goes through, the White House gives pharma what they want, but they don't get the other side of it, which is the public option. They could have had a deal for a regulated insurance company months ago.
Well, every single part of this healthcare bill is controversial in the sense that we have a very conservative Republican Party that has been attacking it at every turn. Yes, clearly Obama made a deal that got pharma to sit on the sidelines rather than join the attack as they did against Bill Clinton's healthcare reform. So it'll be long debated whether that was a good deal or not. What's clear, though, is that many people, the House contains regulation of and competition for the drug industry that goes well beyond Obama's deal. We'll see how much of that comes up in the final version of this legislation.
So let's go back to the point you were about the allowing more people to buy into Medicare, and this is the beginning of Medicare as the real public option. This is still not a done deal. It could still fall apart. Is there a point for you and where if this part fell apart and there really winds up being no public option, is this still some kind of a win?
Well, let me be clear. I think that this legislation should have had a robust public option, stronger than what was in the House. So it was a disappointment when the political system was not able to cope with and find a political majority for a strong, robust public option. Everything else is second best. But if we're going to have a weak and not very effective public option, perhaps it's better to go in this direction of empowering Medicare to be the single payer option.
That holds, because right now apparently the insurance companies and some of the big healthcare providers are screaming about this because they're saying Medicare is not properly funded, and unless you properly fund it, we're going to oppose this.
Yes.
So this is no done deal.
No done deal at all, and by the time people see this, it may have fallen apart already. But it's an indication that Harry Reid knows that he has to give something to the liberal senators who have been quite tough in negotiating, and it's an indication that the Democratic Party knows that there's been a huge mobilization in this country to demand something that goes beyond just throwing money at the private sector.
Now, I was just talking to a staffer on the Hill, and she was saying that there's just exhaustion here now. Now, it's just now like pass anything and let's get on with it, because this is just tiring us and we can't get anything else done. But is there a point where those people that really said there has to be a public option for this to work, and that includes many senators and the majority of Democrats in Congress, is there a point where they have to say, if this thing really, even the Medicare thing falls, that we'd rather this thing crash? Don't take us so for granted that you can assume we're on board. If this is so meaningful to your presidency, you go get those 4 Democrats that are holding all this up and you put the hammer on them, or we're going to let you take a hit on this.
Yes, and some senators, like Senator Bernie Sanders.
But Bernie's kind of on his own out there.
Well, others as well have said, we are not going to vote for something that we don't think moves the ball forward in terms of affordable health care for all Americans, and we're not going to vote for something that simply puts the private insurance companies completely in control of this new expanded healthcare system. So yes, the Democratic liberals need to be ready to walk away, and they also need to be willing to say, let's change gears and use reconciliation, another process in the Senate that would allow us to push through many of these reforms, including the public option, with only 51 votes.
Is that really still being talked about? Because we haven't heard it for weeks.
Again, every once in a while, Reid refers to it, and of course, Democratic liberals are urging him to hold that as an option. In reality, I think what's going to happen is some kind of a deal in which the conservatives will be able to say, we passed something that I insisted not have a public option in it, and they will play down the expansion of Medicare if that's still part of the deal. Whereas the liberals will play up the expansion of Medicare, and the real accomplishment that this legislation will, for the first time, guarantee that all Americans have access to health insurance, and provides a significant reform to the health insurance industry and significant subsidies for those who can't afford health insurance on their own. And you gotta remember that this is a significant step forward for the American people to have a government guarantee of health care of some kind. Not just for the seniors, not just for the poor, but for everybody.
And just quickly, do you think there's a possibility this pharma deal that the White House made will get overturned?
It certainly could be overturned by the House and the Senate, and they're not bound by it in any official way. But it's also very likely that in the next 10 years, as we fight to improve and refine what gets passed this year, one of the first targets will be the drug industry. One of the first targets will be forcing the drug industry to compete on prices and to use the power of the federal government to get them to do that. So whether it's in this legislation or in the next round of reforms in a year or two, I think that's one of the big targets as people realize that we've got to get a control on costs and price pressures.
Thanks for joining us.
Thank you.
Thank you for joining us on the Real News Network.